Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Hollis Barbaro. She is a physical therapist here at East Cooper Medical Center. Thanks for being with us today.
Glad to be here.
I love the glasses. You're looking fabulous. And we're going to talk today about, joint replacement surgery and all of that. It takes a lot of physical therapy. But first off, just kind of give us an overview of what you do here at East Cooper.
I'm a physical therapist. I take care of patients that are here in the hospital. Primarily, we take care of post-operative patients that are here for joint replacement surgeries, whether it be their hip, their knee, or their shoulder. And then we also take care of patients that are sick in the hospital as well. So we have a schedule that we arrive to and go up onto the floors, speak with our nurses to find out a little bit about the patients, and then follow up with our physical therapy care.
And y'all have fantastic physical therapists. I've actually been here to get some physical therapy for my back. So
wonderful.
And well, y'all are known for joint replacement surgery.
Correct.
I mean, everyone knows that. What's kind of your role as far as that goes? I know you communicate a lot with the doctors and things like that. You have a whole way of processing and making sure that the patient is taken care of from point A to point Z, right?
We do. And so we have basically the physicians will schedule the patient for surgery. We have a program in which they do come before their surgery. They have a meeting with the nurses, doctors preoperatively to make sure that medically they're stable. And then they also do a little prehab session with the physical therapist as well, kind of letting them get to know about what they'll need to do after surgery. It's easier under those circumstances. After that, we get to see them. Today, I have several patients scheduled that I will see after their surgery this morning, which is really exciting.
It's that fast. So
it is that fast.
We see
them
quickly.
We call it day zero, we see them.
Oh, I love that. That's a great way of putting
it.
As far as these days, I mean, I know with technology and all of the ways that we have kind of advanced, are you finding that the goal obviously is to get them, make that transition from the moment that they have the surgery and as quickly as you can to get them back to life, probably even better than they were before, right?
I've been a therapist many years, and it has changed dramatically. So our goal is to try and get people discharged day one, the day after their surgery. Some people will be able to do it. Some people will need to stay with us, and we'll be glad to take care of them under the circumstances. Years ago, they used to stay in the hospital 5 to 7 days.
Isn't that crazy how much has come along?
It is. It's amazing. But we realize that we want people activated early after the surgery, and right from the very beginning. Again, a few hours after their surgery, they're getting up with us, going for a short walk, and then we prepare them to go home the next day. And again, watching them very closely. There's a lot of things that we have to do during that process, but I realize that their safety is my responsibility.
So what are some of the ways that we can kind of set ourselves up for success as far as, things to think about? Obviously, this is a surgery that is going to require
You've chosen. Absolutely. So I think that once people have made the decision that so it is an elective surgery, so it's not an emergent thing. So people make these choices. Once they've gone to the doctor and scheduled their date, I think that they know that they're prepared. I still have to walk in there the day of surgery, and people are still frightened and maybe recovering a little bit. So I go in and I'll sit down with them and introduce myself and ask a little bit about what they do and make them more comfortable. So that way I can take them to the next step, which would be showing them exercises and getting them up as well.
I bet with your personality too, you interact a lot with the family. Do you find yourselves giving them tips on how to support?
I think the family sometimes is as fearful as the patient is. I think that they know that they have a responsibility of the patient going home, and what will they do to take care of them. So we educate not only the patient, but then also the family to let them know that it's going to be okay and that it's an active recovery, that we won't let someone go home unless they can take care of themselves. And maybe the family might have to have meals prepared for them, but won't have to take care of the day-to-day responsibilities of getting them in and out of bed or walking around with them or bringing them to the bathroom. The patient will be able to do that once they are discharged from the hospital.
So are you finding though that the recovery time is just kind of, there's a direct connection between preparing yourself and setting yourself up for success and how quickly you know, because you might run into some
There's always,
things that you
there's
didn't know.
always challenges,
Exactly.
and we are prepared for the challenges. I think in that prehab session, the therapist that will see someone under those circumstances will already put it in their mind that maybe they might need a little bit more support. Sometimes we will send someone home with home health therapy, or perhaps maybe they might need a short session of rehabilitation in a hospital setting as well. We have a new program here at East Cooper that we're very proud of. So we will assess patients and make that determination and speak with our case managers about that right from the very beginning.
Well, Hollis, you have fantastic energy, and thanks again for being with us
Thank you,
today.
Ashley. I appreciate it.
And for more information, you can head online to eastcoopermedctr.com.